We're back at the Ferzey Clinic to talk about complementary and alternative medicine. Last week we talked about your first visit to the chiropractor, and we're going to finish talking to Dr. Joe about that today. So Dr. Joe, last time we were here we talked about your first visit to the chiropractor, but now we're going to talk about your follow-up visit.
That's exactly right. So now I've done the exam. If we need x-rays, we have x-rays. And what we're going to do is sit down together and I'm going to lay out a management plan. We'll look at those x-rays. Now, this is assuming that I can manage your case. Sometimes people come in here with illnesses where we have to get your medical people involved, and other times there are even more serious things where we just discharge you from here and refer you directly to a medical specialist. So management includes, as I said in the other show, we may think traction is a part of the program. The chiropractic adjustment that we'll talk about for the bulk of this program is the centerpiece of the treatment in almost all the cases, but not all the cases. Then we have ultrasound and a number of things. We might also recommend some other nutritional types of things, healthy juices, for example, or vitamins, minerals, these kind of things. But that's always tailored to the patient. There's really no cookie cutter. So
when I think of chiropractors, I think of them popping and adjusting things.
Yeah, and most chiropractors do. We call it an audible release, but that cracking sound that comes from the joint, that's a part of the traditional sort of chiropractic adjustment. And I do that here. There are other types of techniques. In fact, there's over 100 different techniques that chiropractors choose from, although I'd say 80% of the chiropractors use 8 or 10 different techniques. So it won't be that different, but in fact, it could be different experience from one chiropractor to another.
So if there are so many different techniques, then how does someone know that they chose the right chiropractor?
Well, first of all, the one thing I would tell people is that if you're going to a chiropractor and you're happy with the treatment that you're getting, you're probably at the right chiropractor. But if you're not happy and you give it a fair trial, then maybe you should just try something else. The technique that I use is that audible release, that sort of popping, again, on most patients. That's not for everybody. And of all the chiropractic techniques, that's really the only one that's been adequately studied in a scientific fashion. There are literally dozens of studies that show that that particular technique has never come in second to anything it's been tested against. So if they compare chiropractic adjustments to anything, and one of the studies we'll talk about, my favorite study is from England, they compared it to hospital treatment for back pain. It has never come in second. It either does as well or better than anything it's ever been tested against.
And what was that study that you said was from England?
This was referred to as the Mead study, and what it did, Dr. Mead actually was retained by the British government to investigate whether or not chiropractic should be added to their National Health Service, what they call the NHS, because they have socialized medicine and they want to know whether or not chiropractic could play a role. So they hired Dr. Mead, who is an esteemed researcher, and he conducted a study actually in 2 parts, published in 1990 and then a second one published in 1995. And I'm going to read you the result of his study. What they did there was they compared chiropractic to outpatient hospital care for patients with low back pain. And his result was that chiropractic treatment was more effective than hospital outpatient management, mainly for patients with chronic or severe back pain. Now, I'm editorializing here. That's exactly the people we want to be better with. The final conclusion that he came to is chiropractic almost certainly confers worthwhile long-term benefit in comparison with hospital outpatient management. Introducing chiropractic into the NHS practice should be considered.
That's really interesting. So what exactly is a chiropractic adjustment?
I think the best way would be to actually show you. So we have a patient, we're going to head over to the treatment room and I'll demonstrate adjustment of the neck, adjustment of the middle back, and adjustment of the lower back. So we'll have the patient lying on their back. We take a look at their neck. We poke around, see if there are any sore spots there. When the patient's on their stomach, we'll perform an adjustment where we push between the shoulder blades. The low back will typically adjust with the patient on their side. We bring one of their knees up and do a maneuver to the back to try and release the joints. For the neck, same thing. We'll have the patient lying on their back, move their head from side to side, always check to make sure it's comfortable, and then proceed with a very short, usually very comfortable adjustment.
Well, Dr. Joe, thank you so much for talking to us today.
Always a pleasure, Kathy. Thanks for coming.
So if you want to learn more about the Ferzey Clinic, make sure to call them or go to their website at ferzeyclinic.com.